So the illegal miners underground have written a note that was brought to the surface by the community members who have volunteered to rescue these zamas, asking for chronic medication. Police say that they will have operations that will assist those underground with medicine. Let's now bring in the Health Minister, Dr Aaron Motsoaledi, on this and whether it is a justifiable request. Minister, very good morning to you. Thank you so much for making time for us. We understand that there was a meeting that was held last night between yourself as well as the Minister of Police in relation to this request for ARVs as well as chronic medication. What can you tell us about that meeting and perhaps your interpretation of this request that has come from underground?
Thank you very much, Aldrin. Thank you to the viewers and listeners. No, we didn't have a meeting with the Minister of Police. I was asking him because you inquired with my spokesperson what our attitude is towards this. And I was asking about the court judgment because we had received nothing as health. We had never received any note or any letter. Everything that we had it from the media as you people were inquiring. So I was asking him, what is it all about? Whether there is any judgment that said the Department of Health must provide antiretrovirals, etc. I was asking Aldrin because the department in itself does not provide anybody with any medication. We develop policies, and the issue of you getting medication is between you and your doctor. Firstly, a doctor must diagnose you and prescribe for you. Antiretrovirals are not Panado. They are not over-the-counter medication. They go from one patient, from a doctor to a patient or a nurse to a patient, following particular policies and standards. But after an encounter with such a doctor, they are not just distributed like food or like water or like vitamins. So that's exactly what I was discussing with the minister.
Yeah, and from that discussion, what's your final analysis around what is required? Because during the press briefing that was held earlier this week, the Deputy Police Commissioner had indicated that the ARVs will indeed be sent down.
Well, I don't know. I don't know how she's going to do that, because who do you send ARVs to, Elvis? As I'm saying, for you to get any medication, especially like ARVs, a doctor ought to have examined you and prescribed them. Under whose name will the ARVs come out? Where will they come out from? What will they be treating? Because we don't know the diagnosis of anybody. So what the minister told me was that the undertaking they gave is that they won't stop anybody as police who goes down there to help somebody. If there's a doctor who is willing to go down there, examine somebody and give them whatever medication, they won't be stopped by police. But we can't just take medicines and say somebody has demanded ARVs, we're taking them there. What if we're causing harm to a particular person? And so that's what I was phoning the minister. So I was asking him what this is all about, how is it going to be done, and under what laws? And that's when he reported to me that, look, as far as he understands the order, the court just said police should not bar anybody from emergency help of those people. And he said that's what they are doing. Community members are going down there to do whatever they are doing. If they happen to be going down with a doctor who is going to administer medication, then the police won't stop such a doctor.
Yeah. Does this apply to any other chronic medication as well, Minister?
Yes. Any chronic medication that is for prescription, because Aldrin, let's get this clear. Medication is only given after a diagnosis. A diagnosis is given after examination by a doctor. Medication is not just given at random. As I'm saying, it's not like you are giving water, like you are giving food, or maybe like you are giving medicines. You are treating a particular illness. And so you have got to know exactly what is that which you are treating and for what. If, on the other hand, one of the minors was already diagnosed and they've got their own doctor and they are ordering that, please allow my doctor to come and give me medication. And That's what Minister was saying, that they won't stop such a doctor. But just to go to the Department of Health and say, I'm demanding antiretrovirals, it's a tall order for us, because where do we start?
Yeah. So does that mean that, let's say the example that you make now of one of the illegal miners underground has been diagnosed before, has a doctor, does that mean that the doctor themselves are the only individuals who will be able to administer or give that particular prescription to this particular patient? They can't send it down with somebody else?
Well, at the moment...
So basically, sorry, Minister, what I'm trying to get to as well is that before, in this particular case, an ARV drugs are dispensed, what is the role of the doctor in terms of looking at the CD4 count and so forth?
Well, this is how ARVs are dispensed and distributed in the country, Audrey. There are different methods that we are using. But as I said, firstly, you have got to have got tested and tested positive, and a doctor must have prescribed them for you. I think that is standard. Secondly, the manner in which you collect them. We've got several programs. Some go to the clinic or the hospital every month to be seen by a doctor or a nurse who is reading the prescription and dispensing the medicines. Others go to pharmacists with a script already written by a doctor, and the medicine are dispensed. One of our biggest programs is called CCMDD, meaning chronic medication. It's about dispensing of chronic medication, whereby you give us an address of where your medication, having been prescribed, must be delivered. We get a service provider who must go and deliver it there. It is called Central Chronic Medication Dispensing and Distribution Program. Millions of people who are HIV positive are on that Central Chronic Medication Distribution Program, dispensing and distribution, because the person who is distributing and dispensing them has got a license from us, and he has won a contract from us that they'll be the ones who are distributing those medicines. If any one of the people under that were there and the person is willing to go, then let it be, because he has already got the contract. But if that person has not been seen by a doctor, has not been examined, is just calling for retrovirals themselves, that will be wrong legally, because you can't just call for any medication without a doctor having examined you or without the doctor having prescribed such a medication.
Yeah. So the state in its case before the court is arguing that the mine workers or the illegal mine workers are not trapped, but they are evading arrest. With that in mind, what is the risk for an HIV positive patient if they do not get their chronic medication?
Well, any patient, not HIV patient, any patient who doesn't get medication will demise. There's no question about that, depending on the state of illness, whether it's HIV, whether it's diabetes, whether the person has got TB, high blood pressure, whatever. If you don't get your medication, you are going to demise, depending on the extent of your illness. That's very clear.
Yeah. Okay, Minister, just quickly on another issue. This is on the food poisoning cases. We had spoken about this before. Now there is this intervention that the President has announced. What's the role of the Department of Health in relation to after the re-registration of these tuck shops?
Well, if you read the President's statement when he was doing a family meeting, you realize that quite a number of the recommendations or instructions that he gave are due to the Department of Health. He divided them into three. The third one being to make sure that this doesn't happen in future. Number one, he said we'll put up a team of experts, ministerial advisory group of experts from various fields like toxicology, pediatrics, pediatric pulmonology, epidemiology, and all that. We are busy putting that such a team forward. We are consulting we are hoping perhaps it's possible that by the end of the week or early next week, we'll be having such a team ready. Where who will sit? Remember, Aldrin, like the team in during COVID, which used to be led by Professor Salim Karim, if you remember, who were advising the state at any turn. When the president announces something to the nation, it will be coming from that team. So it is something like that. The second thing, he said every death of a 12-year-old or below must be notifiable. Now, there are diseases globally which are notifiable, Aldrin. A disease is notifiable under certain circumstances. Not every disease is notifiable. By notifiability, we mean when such an incident occurs, when a health worker meets such an incident from any patient anywhere around the country, they must fill a particular form to notify the state. And within 48 hours, we must be knowing in any corner of the country that's a child who's 12 years old who passed on, and we must know the reason why the child passed on. This is done in order for us to trace whether the poisoning is still happening specifically. The third thing that you mentioned is about having an electronic medical records of deaths in the Department of Health. I knew this one might be very difficult to understand, but we need to explain it. When a doctor writes a death certificate, Aldrin, they write it in triplicate, but the second part, there is somewhere where they don't fill in the actual cause of death. They just mention whether the death is natural, unnatural, or is still under investigation. If the family want to bury before the investigations are completed, then they'll write under investigation. That is what appears on the death certificate. In other words, any death certificate will be telling whoever is reading the death certificate whether the disease passed on through natural causes, unnatural, or whether it's still being investigated. That's all Home Affairs knows. The actual cause of death, whether the person was diabetic and died of diabetic coma, whether it's a stab wound, whether it's a motor vehicle accident with a ruptured liver, all that, that is never seen by Home Affairs. It is sent no, even the Department of Health, for that matter, is only known by the doctor in the hospital and is sent directly to SAPS SA in a sealed envelope, which is self-folding. Under SAPS SA, there's a special team of people who have been sworn to confidentiality by oath. They are the ones who open those envelopes and check the cause of death and provide statistics with it so that you don't find causes of how people died all over the country with people gossiping. Now, that process is a disadvantage because in the Department of Health, we may know after 4 years when State South Africa give stats that so many people died of diabetes. We won't even know who they are. We'll just know the stats. So many died of TB, so many died of HIV/AIDS, etc., etc. Now, this recommendation is that when such certificates are written, we need to have sight of them. Maybe we send them to this team or the Medical Research Council, which has been complaining about this issue, so that they've got sight of what is killing people around the country, not knowing after 4 years or 2 years when State South Africa report, but knowing instantly or instantaneously.
Yeah, so certainly a lot of work that still lies ahead. Thank you so much for your time, Dr.